Well, on Wednesdays, we are joined by Rhode Island Department of Health Medical Director, Dr. Jim McDonald. Dr. M, thanks again for joining us.
Kim, thanks for having me. It's always fun to hang out with you on these Wednesdays.
Well, we really appreciate you being here. Of course, last week we learned that President Donald Trump tested positive for the coronavirus. And it seemed to change the way America is thinking about the virus. So what did you think when you heard that the president himself had contracted it?
Yeah, I felt very bad about it at first, and I still do. I hate anyone to get sick, and I think that's just one key thing is I'm glad the president's recovered. I think one of the things that we really see, though, is that, for a public figure in particular, when you're out a lot, you really put yourself at risk. Like one of the things that I think is a key concept of protecting ourselves is the more we gather, the more we move, the more we put ourselves at risk. And, converse, the less we gather, the less we move, the more we protect ourselves. And so during the pandemic in Rhode Island, that's still a principle I live by. To tell you the truth, I don't go a lot of places and I'm home a lot. And when I'm out, I wear a mask and I'm religiously 6 feet apart from everyone.
In terms of his course of treatment, we have heard that he's been getting dexamethasone, remdesivir, and an antibody cocktail that's being tested by Regeneron. What do you make of the treatment that he's receiving?
Yeah, it was interesting. So one of the things to think about is just when any virus infects us for any reason, one thing just to keep out, when you get any viral infection, the viral replicates in our body for quite a while before our own immune system recognizes it. And that's when we start having symptoms, fever, cough, whatever. What was interesting about the treatment choices for the president was the sequence they were giving him. The Regeneron antibody, the polyclonal antibody, what was interesting about that is that's basically like an instant immune system. What they're basically giving you is antibodies to stop the replication of the virus. So it's an instant immune system. So early in the course of a disease, that does make sense. Keep in mind, though, viruses are still replicating. Then when they got the remdesivir, that also makes sense. That's given early in the disease. What remdesivir does is stop the virus from making more virus. It stops it from replicating. What's interesting about that is we're not very good at creating antiviral medications. Part of the reason we're not very good at that is viruses are really, really good at making more viruses. So that's a problem. One of the things about this virus, the SARS-CoV-2, is it causes inflammation and causes other problems. The dexamethasone really takes care of the inflammation. And that's something that we've known that helps when it comes to managing this disease. And then dexamethasone is a steroid. Kim, not the type of steroid that baseball players were using. That stuff was just weird on so many levels. But this is a medical steroid. It's given all the time, and it does work well. What made me wonder, though, one of the things I wondered was the president sicker than we were led to believe? Because it seems to me that when you think about the remdesivir in particular, that was really reserved for people who were on oxygen and in the hospital. And for the dexamethasone, same thing. So it just made me wonder. And I'm not saying we needed to hear more. I mean, everybody's entitled to their own privacy with their own illness. So I can respect that privacy was important. But that's something that, I would just say I wondered if he was sicker than we were led to believe. And, thankfully, he's doing better. So hopefully he will have a nice, speedy recovery and get back to full working order.
Obviously, the President of the United States gets the top medical care, but for the average Rhode Islander who might unfortunately find themselves hospitalized with COVID-19, would they be able to access the same treatments that the President received?
So definitely on the dexamethasone, that's widely available for everybody. Most probably on the remdesivir, that's in most of our hospitals in the state too, because that had the emergency approval. For the first product, though, the polyclonal antibody, it's possible, but not going to say at every hospital. I know at Rhode Island Hospital, Dr. Malinakis, one of the infectious disease experts there, is participating in the research trial. There's 84 centers across the United States that are doing the research trial on that Regeneron product. Dr. Malinakis is one of them. I know they've enrolled about 25 patients so far in Rhode Island. So we'll have to wait and see. But hopefully people won't get sick and hopefully won't need those options.
So it's possible that some Rhode Islanders have received the Regeneron antibody cocktail?
Yeah, it's part of a research study, so I can't tell you how they've done. What I can tell you, though, is from what I've heard, about 25 folks were part of that study so far in Rhode Island.
Knowing what we know about the course of this illness, we're just over a week away now from the next presidential debate. If the two campaign chairs for Trump and Biden sat you down and said, Dr. M, is it going to be safe for the two candidates to debate in person next week, what would your answer be?
Well, what I would say is, first, they got to stop interrupting each other. They drive us crazy with that. And that just needs to be said first. If they ask me that question, I'm going to say, you guys got to be nice to each other. The second thing I'd say is we use the symptom-based strategy when it comes to determining if you're recovered or not. That means 10 days after your first symptom appeared and you're fever-free for 24 hours and your other symptoms are improving. So if the president meets those criteria, I'd say, sure, it's okay. And I like the interventions they did, by the way, for tonight's vice presidential debate. Little plexiglass, I think that's a good idea. Keep people further apart, nice idea as well. And I think those are meaningful safeguards. But I really do want to underscore, if you're going to have another debate, the rest of us really want to watch it. I was trying to watch it with my 17-year-old. I was trying to show him what a debate was supposed to look like. I was disappointed, and he was too.
Switching gears a little bit, today the governor was asked about the state's test positive rate, and it's reported two different ways. And according to the charts that we have on WPRI.com, it's 5.2% among people who are being tested for the first time, and it's 1.5% among the broader pool of people who are being tested for the first time but also tested again. Which metric are you keeping a close eye on, that 5.2% or the 1.5%?
So I keep an eye on both and a whole lot more. The reason I say that is I'm interested in the positivity rate of people in nursing homes. I'm following the college students. I'm also following the K through 12. And what we're looking at mostly is trends. In other words, how are they doing over time? The director had said today we disaggregate the data. That's a fancy way of saying we look at the data for various groups, because what we're trying to learn is where are the numbers increasing and where are they decreasing? We also look at it by various municipalities in our state as well, because we're really trying to control the pandemic where it is. And one of the things the governor said is we do targeted testing. So we're purposely trying to find out where the positives are. So we do a lot of testing in Central Falls, Pawtucket, and other areas where we know we're going to find disease. Because right now that's the cure to COVID. We do our case finding, then we investigate, and then we have to isolate the sick person and quarantine the exposed individuals. So that's what we're looking at.
And is there any trend right now that's troubling to you, or is it sort of in line with what you expected to see right now?
So, I'm paying more attention right now to Central Falls and Pawtucket and the community spread in the high density communities. I'm paying attention to that. We're seeing a little relief from the Institutes for Higher Education. So that looks like it's heading in a decent direction. We're keeping a close eye on nursing homes because we always keep a close eye on nursing homes. So these are some of the things we're looking at very carefully every day.
Dr. M, anything else you'd like to add or let people know this afternoon?
I think there's some discussion about vaccines going on that's just kind of intriguing. And one of the things I would encourage people just to think about is sometimes it's better just to subtract the noise from all this world and just keep an open mind. And I like to live with what's going on right now and be present. I'm a little bit worried about people who have made up their mind about something that hasn't even been offered yet. And it's a little bit like showing up to dinner as a kid and saying you don't like it, and your mom and dad saying you got to at least take a taste of it. And I realize for a vaccine, it may be a little hard for folks to swallow, but I think to some degree, can you keep an open mind? Maybe don't form an opinion just yet and listen, and let's wait and see what the science shows, and let's see what the research looks like, and then let's see what the national and local experts have to say. I think if you keep an open mind, you'll feel a little bit better about everything.
Rhode Island Department of Health Medical Director Dr. Jim McDonald joins us here on 12 News Now at 4 on Wednesdays. Dr. M, always a pleasure.
Thank you, Kim. Have a great Wednesday.